That is happening. So, thank you. Welcome, everybody. Welcome, Gretchen, Sharon, and Belle from the University of Exeter and the Space Project. I'm going to let you take it from here, if that's okay, and just feel free to start when you're ready.
Great, thanks. I'm just gonna share my screen. Okay, hopefully you can see that. Hi, I'm Gretchen Bjornstad. I'm the lead on the Space Project, and I'll be presenting with Sharon Foxwell and Belle McDonald, who I'll let introduce themselves in a moment. I'm just going to give a very quick little overview of what the Space Project is, and then hand over to Sharon and Belle, who will be talking about how we involve parent carers in this research. There we go. Okay, so hopefully you're seeing the second slide. So this project, the Space Project, is about support for parent carers of children with special educational needs and disabilities. It came from conversations that I and my team had with parent carers who were involved in some previous research that we were doing, primarily around just discussions around parent carers' feelings that many parent carers are likely to have mental health problems that are going unidentified and untreated, and that these mental health difficulties could be related to a range of things that parent carers experience in their caring role. So it could be through the early discovery and diagnosis of their child's disability. It could be through fighting for their child's needs to be met throughout their life. It could be through their child's behaviors, or it could be through limitations in society for their children to access activities, or it could be through recurring health emergencies for their child. And that may not be an exhaustive list, but those are the kinds of things that a lot of parent carers experience. And in the UK in particular, we have a very limited understanding of parent care mental health. There's very limited evidence around the prevalence of this, but they're very likely to be an underserved group in need of mental health support and treatment. So this project has two broad aims. One is to learn about the prevalence of mental health problems for parent carers in England, both before and throughout the COVID-19 pandemic. So we're looking at that through examining three different types of data to kind of look at it from different perspectives and through different types of information that we have available to us. And then the other main aim is a mapping study where we're trying to learn about what are the current pathways to identification of mental health problems for parent carers, and also how they might be accessing support and treatment for their mental health. And we're doing that by conducting a survey of parent carers, which is currently open at the moment. And that will be followed by interviews with parent carers to learn a bit more about their experience in gaining access or not to mental health support and treatment. And then we'll also do a survey of professionals in health and social care and education, as well as commissioners. So in this project, we involve parent carers in a couple of ways. We have three parent care co-investigators. Sharon and Belle are two of those. Those are parent carers who expressed a need for this work when we were thinking about applying for funding. They were co-applicants on the funding application, and they have extensive experience in being involved in research, as well as being really well connected to networks of parent carers around the country. We also have a parent care working group with 12 parent care members who provide us a wider range of perspectives. They meet on a termly basis and also are involved in other ways throughout the project. They provide us with feedback on our plans as they move along, and they steer the project. And we also try to regularly provide updates to them, both on how the project's going generally, but also on how we've incorporated their feedback into the project. And they certainly are a very vocal group, and they definitely push us to make the project as good as it possibly can be, which is really helpful. But I'm going to hand over to Sharon next, who's going to talk about her experience as a parent care co-investigator on space.
Sharon, you're muted.
It's a rookie error, isn't it? Hi, thanks, Gretchen. I'm Sharon. I'm a parent carer, and this is my little girl, Polly. Polly is 8. She's got complex epilepsy and a learning disability. She's a complete live wire. She's really sassy. She's got a cheeky smile, but as you can see from these pictures, we have some really difficult times with her seizures. She's frequently hospitalised with seizures, and they're not controlled with medication. So from a mental health perspective, it's a really challenging situation. And when I became a parent carer, obviously, like all parent carers, it wasn't something I asked to do, but I became one. I really had no idea that any of my lived experience really held value when it came to research or co-production. I just didn't really know that was a thing. And so when I heard about the University of Exeter's family faculty, which is a group of parent carers that get involved in research projects, I heard about it through a friend and found myself going along to my first meeting. And I loved it. I loved taking part. And since then, I've got involved in all sorts of different research projects. And more recently, I've been a co-investigator on the space project. And as soon as Gretchen talked to me about that project, I just knew I had to be involved because it's such a vital area. It's such an overlooked area. And I think parent carers have a unique set of circumstances when it comes to their mental health. And there are particular barriers to that particular client group. Next slide, please, Gretchen. Thank you. So I'm just going to talk to you about what I love about my role, my PPI role. First and foremost, I think what really stands out for me is this is something I'm involved in because I have a disabled child, not in spite of having a disabled child. And that's how life can often feel as a parent carer. Just getting involved in stuff can actually just feel really challenging. But the reason for being involved in this is because I have a disabled child, and we have some really, really difficult times with Polly, and it's just amazing to be able to use that really hard-won experience to actually make change happen. So to be able to sit in these meetings and see things shift because of what we say, and no, it's not tokenistic, it's not tick box, we're respected as equals, is hugely empowering, actually. And interestingly, from a mental health point of view, has a really positive impact on my well-being. You get to meet new people. I don't, apart from knowing a few people, I haven't spent lots of time with academics. I have a separate career to this. I work in comms. But I've not really been in that world, so it's really nice to meet people doing different things, and also, and really importantly, getting to meet other parent carers from different backgrounds, different areas of the country. That's a hugely powerful thing for me, and we'll often find ourselves in meetings going off in tangents because we can often really identify common themes. So that can be that's a brilliant thing about being involved. And also just gaining new skills and experience, actually. And this, for example, on the space project, part of the work is going to be interviewing parent carers about their experience. And we're going to be potentially sitting in on some of those interviews. And I hope that in doing so, we can make those parent carers feel more comfortable because they're supported by another parent carer. And those skills and experiences can be really powerful for me because I can use them in all areas of my life, my career, but also in advocating for my child. And any parent carer you meet will know what it's like to have to become an advocate for your child. So that's really powerful. Next slide, please. And yeah, so challenges of being involved as a parent carer. Probably the most obvious one that might come to mind for most people are time commitments, particularly in our case. Our daughter's condition is ever changing and it's very sudden. A great example of this is when we were actually putting this together last week. I was on a call with Belle and Gretchen and my daughter had a seizure. She was downstairs with her carer and there was a shout up the stairs and I just had to disappear. And I know that it's a safe space to be able to just disappear from, and that all the people involved in this understand that, but it does mean that yeah, I have to be really careful about my time commitments. And when my daughter is well enough to attend school, that time's really precious. So I use it really carefully, and thankfully being involved in this is a really positive way for me to use that time. But there are obviously times when I have to be flexible. Yeah, acronyms and unfamiliar terminology, that's a challenge. I don't know that I've ever sat in any meetings where acronyms have been used so frequently. And I've, as a co-investigator, it's actually been quite different, because I've been sitting with the steering group and seeing, I'm really under the bonnet of research evolving, which has been really interesting. But it does mean that there's loads and loads of jargon and terminology and acronyms, and the team are really good at taking time to explain those. But there are certain ones that are used every week that obviously they can't keep repeating. So what you've got on the screen on the right hand side is my own little crib sheet, which I scribbled in the back of my notebook when I first started on this project. And every time I come to a meeting, which are monthly, I have this open, and it reminds me who works on what bit, what work package 1A is, what all the acronyms stand for. And the reason I need that, I'm generally okay at remembering stuff, but actually for a parent carer being involved, we parachute into the meeting, and then in between that month, I'm back into my life as a parent carer and doing my other job. And so whereas the rest of the team are living and breathing this work, so for them this just rolls off the tongue, but for me I need reminders at each meeting. So that's my little crib sheet, which has been really helpful. And I'm also really conscious to remember when I'm sitting in the meetings that yes, I have my own experience, but actually, particularly as a co-investigator, I want to be a voice for the community. Now, obviously, I can't speak for everyone, but I know the stories that I've read and the things I've heard and the things that are important to people. And so I try to, where possible, zoom out and remember that this isn't just about my experience or my story. I'm trying to be a voice for as much as possible for the parent carer community. And that's where the working group comes in, because that's a bigger, more diverse group of parent carers who all have their own experiences to bring. But yeah, I'm just going to finish my bit by just saying that as parent carers, we often inhabit a world where we don't have a lot of control, we don't have a lot of say. We're typically referred to as mum or dad regularly by people that aren't our children. So mum thinks this, dad thinks that. And actually, you can really feel a sense of a loss of identity. It's not what happens for everyone, but I know that it happens frequently. And so to actually be involved in something where you're being really listened to intently, it's not tokenistic, and what you say can make real change, can just feel hugely empowering. So being involved in this kind of stuff has been a really positive experience for me, and as I mentioned before, really supports my well-being. Thank you. Passing on to Belle, I believe, who's going to talk a little bit more about the working group.
Thank you, Sharon. So I'm Belle, and I'm also a parent carer co-investigator on the space project. But Sharon has so beautifully told you what it's like to be a co-investigator, and I wear two different hats with the space project, because I also work for the University of Exeter at Pencrew, which is Childhood Disability Research Unit, as a family involvement coordinator. So I'm kind of responsible for sort of recruiting the family members to sort of for the working group. So I'm going to be talking about that role rather than my co-investigator role today. So I've worked for many years with parent carers in different roles. So I kind of, like Sharon said, I bring like lots more than my own experience. But I just wanted to introduce you to my boy, because I wouldn't be sat here today without him. This is Fergus. He's now 24, and he has Down syndrome, and also he's got a diagnosis of autism as well. And in the 24 years of being lucky enough to be his mum, he's taught me so much, and I've met so many wonderful people. So I'm always grateful for that. Thank you, Gretchen. So the working group. As Gretchen said earlier, we try and meet with a working group once a term. But we wanted to sort of tell you a little bit about how that working group came about. So I knew from my experience of working with parent carers that this would be quite a hot topic. They would absolutely be really interested in it. The family faculty, you know, we'd have be inundated with people. So we kind of thought about the number of people we wanted, and we kind of hit on sort of the magic number of 12, which means that there's always enough people to come to the meeting, because people can't always make every meeting. And when the opportunity went out to the family faculty, we were inundated, and we had to think of a way of choosing those 12 members, and we really wanted it to be fair. So myself and Gretchen had a conversation about that we wanted sort of representation from different geographical areas. We also wanted to make sure that people that had volunteered for the opportunity maybe weren't involved in other things as well with the family faculty. And then once we sort of used that criteria, we then randomised the rest, which is quite good fun. The little see who we got, so that we felt that it was really fair way of picking it, because you know that we just couldn't have included everybody that volunteered. We do have a reserve list, so people that if people dropped out, or if there are other opportunities to respond via email and stuff, that we are asking them as well. So planning the meetings is quite important. I think, you know, it needs to be meaningful involvement. We absolutely, it's not okay just to have a meeting and talk at the family faculty and not ask their opinions, and actually make it a meaningful experience for them. With the family faculty, we use ground rules so that everybody kind of has an acceptance of these rules. Everybody, the researchers and the family faculty members, the working group members, we kind of abide by this, you know, and it's standard stuff, respect. But I think for me, the most important thing is nobody is just anything. So I'm not just a parent carer, and the researchers are not just researchers. It's about all our shared experience. We also added for this meeting, because I think Gretchen felt it was important, that because it is quite an emotive subject, we wanted to give people permission not to necessarily name it as their experience, so they could share, so that they didn't have to feel. So we wanted them to feel comfortable to be able to share, and if they felt more comfortable to kind of anonymise it by saying that they don't relate to them. And I think this helps people to be honest, actually. We usually do some warm-up activities, which just gets everybody comfortable and sort of ready to work to have the conversations in the group. And I think the key thing is that we think about what we need to get from the meeting. So and to make sure that we ask the right questions to get the required feedback. We use breakout rooms, and we use Google Jamboards sometimes to capture the discussions, because it's quite a visual thing, and it just is a good way of capturing the discussions. Thank you, Gretchen. So I'm just going to talk you through the meetings now. We've had 3 meetings so far. And in the first meeting, we wanted to give the working group, because it was the first time they'd met as a working group. Some of the members knew each other from other things, but we wanted them to have an opportunity to talk about their own experiences of their mental health and their children and young people's mental health issues. And we felt that was important, because they were going to want to talk about it, and allowing them to do that kind of set the scene and set the it then didn't dominate the rest of the meeting, essentially. So we also wanted to know about the different definitions of SEND, so which one they thought kind of best summed it up. We asked what conditions that we should look for, the mental health problems that affect parent carers, mental health treatments that they might access and how they might access those. So what did we learn from that first meeting? I think the key thing is we learned that we tried to cover too much and we ran out of time. And actually that's really crucial learning, because now in the next meetings, in the following meetings and the meetings to come, we're not going to try and do everything. And I think we just kind of wanted to get their input, I think. So but actually we ran out of time, so we didn't get everything that we needed for that meeting, so we learned a lot from that. But the discussion did help us to decide what to include in the list. So we now, in the code list, so we now include no diagnosis and learning disability flags. I think particularly I remember that discussion saying that actually, you can have a learning disability but with no diagnosis, or the learning disability is the diagnosis. And I think we might have missed some without that. Also included rare genetic conditions and eating disorders as a result of the discussions that we had. Thank you, Gretchen. So the second meeting, we asked how the pandemic affected the mental health of children and young people with SEND. Now we asked this first because we felt that might be what they wanted to talk about, because it's been a really tricky time for our children and our families, and what was currently affecting the children. Now, what we really needed to know is about the mental health of the parent carers, but by sort of talking about the children first, it really helped to get those conversations flowing. So we asked about how the pandemic is affecting the mental health of parent carers and what is currently still affecting the mental health of parent carers. We also asked them to look at the previous the parent carer wellbeing survey, and looking to see what is most likely out of the things on the list, what were most likely to affect the mental health of parent carers additionally, so like domestic violence, for example. So we learned quite a lot from this meeting. I think it was interesting to know that for some families, lockdowns had a lot of positives as well as the negatives. Some of the families sort of shared that their children were less stressed. They didn't have to go into school and mask their autism, for example. Some of the anxiety was reduced. So, I think that was quite an interesting finding. I think potentially me and Sharon and Anna, who's the other co-investigator, kind of suspected that a little bit. But, the working group were very clear on that. And I think for many, it seemed to be that the transition out of lockdown has been more difficult. Having to go back to school, having to start coming out of being just at home all the time was quite difficult sometimes. And I think the struggle to get support since the pandemic is a key factor affecting parent carers' mental health. I mean, still now services just aren't there anymore. Things that shut because of the pandemic never reopened, or there's more of a need for it, so you can't access it as quickly. The waiting lists are longer, for example. We also learned of other factors we might sort of want to think about in future surveys. Thank you, Gretchen. So the third meeting was where we looked at the parent carer survey and we tested it. And I think it was a really useful meeting because we asked the working group to actually try filling in the survey and giving us feedback about what it was like for them to feed it in, and anything that was a bit glitchy. And I think it was without that opportunity to test it, it potentially would have gone out with a few glitches. So I think it was a really useful meeting. So we made some major and minor changes after the testing. I think it was generally positive. But for example, a practical change of adding a go back button at the end before finalising it was felt to be useful. Some wording changes. For for example, instead of asking about private treatment, say, what did you pay for? Other suggestions were to ask about parents masking, ask what support carers assessment led to, if any. Adding some changes to the child's diagnosis options. I think profound and multiple learning disabilities maybe was missed off, so PMLD had been missed off, which would have missed a whole quite a large chunk of children. And another key thing, I think, was to add the signposting to the survey itself, not just as an information sheet, because obviously filling in this survey might have caused some distress. It might have brought things up for people. So having that signposting actually within the survey was felt to be useful. I think the key thing that I want to say and that I want to end on is, much like Sharon said, being part of this group is really empowering, because all of the suggestions were incorporated into the survey. They weren't just like, oh yes, and then sort of brushed to one side. They were taken, you know, they were really listened to and valued. And I think that is so important when you're thinking about PPI with sort of family carers. I think it is really important that what they say is listened to, and it certainly is in the space project. So we've got more. We're in the process of planning the next meeting, where we'll be looking at the results of the parent carer survey a little bit, which is going to be really exciting, I think. Thank you, Gretchen.